Why does anus itch? A persistent need to scratch your bottom, also called pruritus ani, is a relatively common complaint. There are a number of reasons why anal itching occurs, and more often than not, it can be successfully treated. What is the anal itching? Pruritus ani is the medical term for anal itching or itchy bottom. It is defined as intense itching around the anus. Other terms include anal pruritus, perianal itching, anorectal itching, itchy butt, bum, bottom. The anus is the opening at the end of the gut or digestive system, allowing us to expel solid waste from the body. Pruritus ani refers to itching around the anus. Anal itching is a symptom, not a disease in itself. It is a surprisingly common problem which many people are too embarrassed to see their doctor about. Pruritus ani can happen to anyone but is said to be more common in men than women and more common in adults than children or the elderly. What can begin as a brief irritation can soon become a chronic problem as the scratch-itch cycle continues. Scratching causes tiny little breaks in the skin that are intensely itchy when the usual moisture and humidity of the perianal area comes into contact with them. This causes more scratching and further tiny itchy cuts. This scratch-itch cycle is made worse by nighttime scratching when the sufferer is half asleep and unaware that they are scratching, especially as loose nightclothes allow easier access. When urine passes over the cuts in women, it causes stinging, which is then relieved by over vigorous wiping with toilet paper, again further damaging the skin. Often the condition can be cured by a strict no scratching period, which allows the skin to heal and breaks the cycle. However, a physician should examine the skin and lower bowel to make sure there are no medical problems. Causes of anal itching. Pruritus ani can have a primary or secondary cause. Primary cause, the itching is not the result of another condition. Secondary cause, the itching has an underlying condition that causes the itching. The list of secondary causes can be collected into broad groups: hygiene, too much or too little; skin irritants such as soaps; skin conditions such as dermatitis and psoriasis; anal or rectal disorders, piles and anal fistulas and fissures, for example; infections including parasitic and sexually transmitted; systematic inter-body medical conditions including aplastic, anemia, diabetes, inflammatory bowel disease, jaundice, leukemia, lymphoma and thyroid disease; foods, dietary irritants such as chili peppers. Some foods may make the itching worse, so identifying and avoiding this may help. Examples include tomatoes, spicy foods, citrus fruits such as oranges, nuts, chocolate, dairy products, coffee, excessive liquids such as milk, beer or wine. Dermatological or skin causes. Prolonged contact with faces can cause irritation. People who have fecal incontinence, little or no control over bowel movements, can have leakage, which can cause irritation and itching. Persistent diarrhea can cause irritation by nature of the frequency of or bowel opening and wiping clean. Eczema and idiopathic dermatitis can affect the anal area. This is inflamed skin of no known cause. Keloid scar of skin. These are hard Smooth growths that develop when scar tissue develops excessively. Scabies, a skin infection. Allergic dermatitis may be due to allergic reactions to creams, lotions, bubble baths, washing powders, wet wipes, etc. Sometimes creams that are used to soothe or treat the itch cause a worsening of the problem because of the chemicals they contain. Pinworm is a very common cause of itchy bottom in children and families with young children. Female pinworms lay eggs in the folds of the anus. This can cause itching. Hookworm infection. These are parasites that can affect the lungs and small intestine. Small skin tags may hide fecal residue or trap moisture, causing itching. Some sexually transmitted infections can cause itching in the region. Psoriasis is a chronic skin condition. It can also affect the perineal area. Proctitis. The inner lining of the rectum becomes inflamed. Gastroenterological bowel causes. Hemorrhoids or piles can cause local irritation. Anal cancer should always be considered and checked for. Inflammatory bowel disease can cause frequent diarrhea and irritation. Systemic whole body causes. Diabetes, liver disease, thyroid problems, blood cancers, anemia, rheumatological diseases, autoimmune diseases. Psychological or mind causes. Anxiety, stress, and depression are all known to make anal itching worse. Home remedies and self-care. Avoid highly seasoned and spiced foods and maintain a regular bowel habit. Keep the anal area clean after emptying the bowl. Avoid medicated, perfumed or deodorant soaps. Use only plain warm water for cleaning. Use moist toilet tissues instead of paper. Avoid allowing the anal area to stay moist and dry it gently by dabbing, not by rubbing. Use drying powders but not medicated or scented ones. Avoid scratching the area, which creates further trauma and makes the problem worse. Wearing socks or cotton gloves on the hands may reduce the harm from unconscious scratching for people who find they have been unable to resist overnight scratching. Wear loose, breathable clothing, avoiding materials such as acrylic and nylon which trap sweat. Understanding and educating about the scratch itch cycle is very important. The skin must be allowed to heal to reduce the irritation that causes the scratching. Avoiding irritating soaps and creams and keeping the skin cool, dry and clean is essential.